Hello, and welcome to Phlebotomy, Butterfly Vacutainer Method. I'm going to demonstrate to you the proper way to use the butterfly vacutainer method to obtain blood samples from a patient. The first thing that I want to do is receive delegation from the nurse. So the nurse will come up to me and say, we have a patient, her name is Jean Gray. She needs some blood work done. Do you have some time to do that? So I'll say, sure, no problem. What tests would you like me to run? And the nurse has told me a PT, BMP, CBC, and type and screen. I want to ask the nurse which method they would prefer I use to draw the blood, and my nurse tells me the butterfly vacutainer method. Now, it is important to ask which method would be preferred just to make sure the nurse doesn't have any additional information for you on what would be best for the patient. I also want to ask the nurse if the patient has any restrictions, is on anticoagulation, or has any allergies. Even if they tell me, I'm still going to double check with the patient. And then I can ask if there's anything else I need to know. Once I've gotten delegation, I'm going to head to the supply room to gather my supplies. So for the butterfly vacutainer method, I want to grab the butterfly needle that has the rubber covered needle on the end of it. This needle can hook up to my transfer device or my vacutainer holder. Let me grab that real quick from the other shelf in the supply room. Here we go. It hooks up to the vacutainer holder, so that'll screw right on there to hold the tubes in place. I want to make sure that I check the expiration date on all of my supplies as I grab them from the supply room. I want to make sure that I get the correct tubes for the test that I've been asked to run. The nurse has said PT. The PT is to check for coagulation, and since this is a butterfly vacutainer needle, I need to make sure I have two blue tubes, one tube that I'm going to use as a waste tube, since the blue tube cannot have any air in it. And the max volume on my blue tube is 2.7 mLs. I'm also running a BMP, which is a basic metabolic test, which is my gold tube. My gold tube holds 4 mLs at max. The minimum amount is 1. I have my pink tube for my type and screen. This tube holds 6 mLs. The minimum amount needed is 5. And I also have my lavender tube for my CBC. This is my blood count. The maximum that this tube holds is 3. The minimum is 1.5 mLs. So I have my needle, I have my tubes, I have my vacutainer holder. I want to grab gauze, alcohol, tourniquet, and on all of these things, the expiration date will be on the box in the room. On all of the tubes, the expiration date is on the label. I also want to make sure that I bring in bags so that I can double bag my specimen to send it to the lab. If you are at Fairfax, you need to bring in a total of 4 bags because your type and screen, your blood bank specimens, go to a separate location, the blood bank. And the rest of your specimens will go to the lab. So you'll need to bag them up in 2 separate bags, so a total of 4 bags. Any of the other hospitals or locations, all of your samples go to the same place, so you would just need 2 bags. Once I've gathered all of my supplies, I'm gonna head to the patient's room.
Come in.
Hi, I'm gonna do AID. My name is Teresa, I am your clin tech. I am here to draw some blood to send to the lab for some tests. It'll take about 10 to 15 minutes. Is now a good time? My patient said, sure, it's a good time, but she wants to know what tests I'm running. So I wanna make sure I can explain all of my tests to her in a way that she understands. So I'm gonna let her know we're drawing a PT, which is to check for coagulation or how quickly her blood clots. We're also drawing a BMP, which is a metabolic test, or to test her electrolytes and her chemistries. We're also going to be drawing a lavender tube, which is our CBC, so this is a complete blood count, so it tells us about your different type of blood cells. We're also drawing a type and screen, which is to check your blood type. If she tells me she knows her blood type, I'll let her know for her safety. We want to have it on record at our hospital, so that's why we're going to check it anyway. So I've explained to her the tests. She also asked me if this is gonna hurt. I will be honest with her. It will sting a little bit because I'm using a needle, but the needle is very small and it won't be in your arm long. So I want to make sure that she understands that. So once I've done my AID, I'm going to move on to Ask, Ensure, Verify. So I'm going to bring my report sheet or whatever I'm using to verify her identity over to her bracelet. I'll ask her to state her name, Jean Gray. So I heard her name, I see her name on her bracelet, and I have it on my report sheet. Then I'm gonna ask her to verify her birthday, 12/1/64. So I hear that, I see it on her bracelet, I see it on my report sheet. So I've made sure to ID my patient correctly. With phlebotomy, when we do our Ask Ensure Verify, we have an additional step to make sure that the labs that are ordered are in the computer. So I'm gonna head over to the computer and I'm going to log in with Soft ID. Once I log in, I want to scan my patient's bracelet, beep, to pull up her chart in Soft ID. There I can see all the tests she has ordered. So I need to make sure that the tests we're drawing are in there. If they're not, I'm gonna call the nurse and let them know because I cannot draw blood for tests that I don't have in Soft ID. So I know she's good there. So I'm gonna come back over and wash my hands since I touched the computer. And I have a few more questions for her. So, Miss Gray, I'm gonna ask if you have any restrictions. These would be a stroke, a fistula, a mastectomy, or a PICC line. And I'm also gonna look to see if she has any bracelets on her wrist. And I see she does have a limb alert. And she tells me she had a mastectomy on the right side, so I'm gonna know not to use the right side and to go to the left side. If she told me she had a fistula, I'd wanna know the location. If she told me she had a stroke, I'd wanna know what side is affected. And if she has a PICC line, I'd also want to know where that is. And I'll look at the arm for that. I also wanna ask her if she's on anticoagulation, since I'm gonna be putting a needle in her arm, and that can lead to bleeding. I do see she has the green anticoagulation bracelet on. And so she does tell me she's on blood thinners. So I've asked my restrictions. I also want to cover allergies, and I do see that there's an allergy bracelet on her arm. So I want to make sure that she's not allergic to anything we're going to be using for this. So, Miss Gray, are you allergic to rubbing alcohol? No. Or adhesive tape? No, she's not allergic, so we're in the clear. So at this point, I actually want to look at her arm and make sure that her arm is good for use. So she has a restriction on the right arm, so I'm looking at the left arm, and what I'm gonna do is look for bruising, for wounds, rashes, burns, anything that's gonna stop me from using this arm. So I don't see anything on this arm, so I know I'm good to find a vein. So I'm gonna grab my tourniquet, and my tourniquet has a time limit of 1 minute, so I can't leave it on longer than a minute. With my Vacutainer, butterfly Vacutainer method, I'm probably gonna aim somewhere for the forearm. So I'm gonna put my tourniquet under her elbow, and I'm gonna tie it tight enough to let the blood pool, but not so tight that it is really hurting her. So now that I have that on, I'm gonna palpate for a good vein, and I'm feeling for a soft, bouncy vein, no pulse. If I feel a pulse, it's an artery, and I don't want to use that for phlebotomy. The vein does not have to be completely straight since I'm not putting a catheter in. The straighter it is though, the easier it'll be, so if you can find one, that's great. So I found a nice, soft, bouncy vein, no pulse. So I'll take the tourniquet off. I'm gonna wash my hands, and I will set up my supplies. To open my needle, there's a little arrow on the, there's supposed to be a little arrow right here on the back of the package to show you where to open it. So I can open that up and take my needle out. I will twist my Vacutainer holder onto the needle, and I want to make sure that this connection is tight as well. Once I have that set up, I can just leave it sitting in its container, and that way it's nice and organized. I want to make sure that I have my tubes arranged in the order of the draw. So blue goes first, then gold, lavender, and pink. So I have all of my supplies set up. Now I'm ready to put my gloves on so that I can do the stick. So I'll wash my hands first. Put my gloves on, and I'm gonna get ready to clean her arm. The entire time that I'm working, I want to make sure I'm letting my patient know what I'm doing. This will help reduce her anxiety, and that will actually help me find a vein better. So to clean her arm for phlebotomy, I'm gonna use 2 alcohol wipes. I'm gonna clean for a total of 30 seconds, but I'm gonna do each wipe twice. So I'm gonna get my first alcohol swab ready, and I'm going to clean the area of insertion for 15 seconds. Watching the clock to make sure that I actually have 15 seconds. All right, I'm gonna get my second alcohol swab ready. And watching the clock, I'm gonna clean for another 15 seconds. Making sure that I'm scrubbing and using good friction to get any potential germs off. All right, that's my second 15 seconds. I now need to let the alcohol dry. So while that's drying, I'm gonna get a piece of tape. I'm gonna put it on the back of my glove because this is the cleanest area. I also wanna make sure I'm talking to my patient. Miss Gray, we're just letting your arm dry. We're almost ready to get started. And I wanna make sure that I don't fan on the arm. I don't blow the arm to get the alcohol to dry. I don't pat it dry. She's keeping her arm still because I don't want anything to get the site dirty after I've cleaned it. So after my 30 seconds is up, I'm gonna look at the arm, make sure it looks nice and dry, and then I'm gonna put my tourniquet back on. I wanna make sure that I do not contaminate the area I just cleaned. And for phlebotomy, I want my tourniquet to be about 3 to 5 inches over the insertion site. I'm gonna look at my needle. This is my butterfly. I wanna make sure that I can see the gauge written on the wings. The black button that retracts the needle should be facing me, and the wings should be flat side towards the patient. That way I know when I take this needle off, the bevel is going to be facing me. For phlebotomy, I can hold this needle 2 ways. I can hold the back of it like this, or I can hold the wings and insert it like that. You can choose whichever method is more comfortable for you. So I'm going to take the cap off my needle. I can see that the bevel is facing me, and I'm gonna get ready to do my insertion by holding or anchoring the vein below the insertion site with my non-dominant hand. I'm gonna line the needle up with the vein, insert it at a 15 to 30 degree angle, and then when I see flash come back in the chamber, I'm gonna anchor the wing with my thumb that was anchoring the vein. My first tube in the order of the draw is blue, but I wanna make sure that my blue tube doesn't have any air in it. So I'm going to use my waste tube first, and as soon as I get blood into that tube, I'm gonna pull it out so that I don't confuse it with my full tube, and I'll set that off to the side. So now I can fill up the rest of my tubes. So I will let them fill until I notice that the blood has stopped filling the tube. I wanna make sure that I always keep my tubes either horizontal or at an angle. I don't want them straight up and down when they're filling because I don't want to risk hemolyzing the blood. Then I'm going to continue to fill my tubes in the order of the draw. So blue, gold, lavender, and pink. Final tube. Gonna let this fill up. All right, once that final tube is full, I'm gonna take it out of the vacutainer holder. I wanna take my tourniquet off next since I have a time limit. I'm gonna grab some gauze and have that ready at the insertion site. Then I want to push the button to retract the needle. Once the needle's out, I hold pressure at the insertion site. My patient's on anticoagulation, so I'm gonna hold pressure for 3 to 5 minutes. I wanna pick up all of my tubes and I wanna invert them correctly. So my blue tube is inverted 4 times, my gold 5, and my lavender and pink 8 times. So we're gonna do that together. 1, 2, 3, 4. I'll put down my blue tube. 5, 6, 7, 8, and put down the rest of my tubes. So I'm gonna wait the time to make sure that my patient has stopped bleeding. So it's been about 3 to 5 minutes. Once I think she's finished bleeding, I'm gonna make sure I check, and if she's not bleeding anymore, I'm going to tape down this gauze. If I notice that she's still bleeding, I'm gonna continue to hold pressure until the bleeding has stopped. If I don't wait till the bleeding is stopped, when I come back in to check on her later, there's a high chance she's gonna have a bloody arm and she's gonna develop a bruise right here. So I wanna make sure I'm holding pressure. So now I've collected my sample. The next thing I'm gonna need to do are get my labels. I have to go back to the computer to do that. I wanna make sure my patient is always safe. If I've raised the bed to do my phlebotomy and I have to leave the bedside to go to the computer, I'm gonna put the bed back down and raise the side rails. If the computer is right next to the sharps container, I can take my sharps with me. If everything is right here in the same area, I can leave everything here, go to the computer. So since I'm going to the computer, I'm gonna remove my gloves and wash my hands. And I've already checked and pulled her screen up. So all I'm doing now is going to be to select the labels that I want to print. She might have additional tests listed here. So if everything is automatically selected, there's a little printer button that I can click to uncheck the labels, and then I'm going to select the ones I want. So I have my PT, my BMP, my type-in screen, and my CBC. Then I'll click print, and my labels will print out. Now, I have to bring my labels back to my patient because I need to check the Give Me 5. That's the patient's name, the final 4, the last 4 of the MRN, and I want to check to make sure my U number, today's date, and time of the draw are on these labels. So I'm going to do that for each of my labels. So on my light blue label, I have Jean Gray, final 4, 2125, 2125, today's date, the time, and my U number. On my lavender label, I have Jean Gray, final 4, 2125, 2125, today's date, today's time, my U number. On my pink label, I have Jean Gray, final 4, 2125, 2125, today's date, today's time, my U number. And on my last label, my gold label, I have Jean Gray, final 4, 2125, 2125, today's date, today's time, and my U number. So I've checked all of my labels, they look good. Now I'm ready to label my tubes. Since my tubes have blood in them, I want to put my gloves back on. So I'll wash my hands, put my gloves on. And I'm gonna label my tubes. It doesn't matter what order you label them in, I always start from the bottom. So the first label I have is light blue. Since my blue tube is a short tube, I wanna make sure that I get this labeled pretty close to the colored top to make it easy for the lab to read. I like to bend my labels back. The patient's name always goes towards the colored top of the tube, and I'm gonna cover the manufacturer's label. So I can spin that around, and my blue tube is labeled. Next I have lavender. So I'm going to grab my lavender tube. Again, this is a short tube, so I'm gonna put the label close to the colored top so the lab can read it easily. Cover the manufacturer's label. My lavender tube is ready to go. Next I have my pink. This one's a long tube, so all I have to do is cover the manufacturer's label. And my final tube is my gold. Again, a long tube. So I'm gonna put that label on there. Now, different units have different practices regarding blood specimens. So if your unit wants a nurse to check off your specimens before you send them, that's fine. Like I said, different units do different things, so you might see something on your unit. At this point, I have collected my sample, and now I need to clean up my patient's room. My tourniquet always comes out from underneath of the patient. It's one-time use, so I'll throw that away. I want to make sure that my sharps go into the sharps container, so I'll put that in the sharps container. I have a waste tube that has blood in it, so this needs to go into my biohazard container. Any other trash that I have, I can throw away. And I'm going to collect my specimens in the computer. Since I'm going to the computer, I'm taking one glove off, grabbing my scanner. I'm going to scan each tube. Beep, 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 beep. So my specimens are collected, and I can see that on the screen. And then to finish the entire process, I need to scan the patient's bracelet. If I forget to scan her bracelet, the lab is not going to accept my sample, and I'm going to have to redraw. Beep, and I'll see that everything is completed. I'm then going to grab a bag, and I'm at Fairfax, so I'm going to put my pink tube in one bag. I'm going to grab another bag to put my other tubes in. Take off my glove, wash my hands. I'm going to seal up these bags, roll it up, put it inside a second bag, and then I want to make sure that my extra labels go with it. So I'm doing my PT, CBC, and BMP in here. So I have my PT, my CBC. This is my type in screen label. And then this is my CMP label. So I'm going to put those in that bag. Put my pink sample in the second bag with the pink label, and I'm ready to send these. I want to make sure that my patient's doing good. Ms. Gray, are you okay? We're all finished. I'm going to send your sample to the lab. I'm going to go through my P's and Q's. So ask her if she has any pain, if she needs to go to the bathroom, which is potty, is she comfortable, her position, does she have all of her possessions, does she have her phone, her glasses, anything I can get for her. I want to do prevention, make sure her bed's in the lowest position, she's got her call bell, side rails are up as appropriate, so preventing falls. I want to make sure that her pump looks okay if she has an IV. I'm also going to look at the IV site to make sure that looks okay. And make sure the room is quiet enough for her, ask her if she has any questions. So I've done my P's and Q's. Then I'm ready to leave the room. I'll let her know I'll be back in about an hour. She can call me if she needs anything, and I'm going to send my sample to the lab. Before I leave the room, I wash my hands, and we are finished with our butterfly vacutainer method. Thank you.